Hi, this is Tom from ZeroToFinals.com. In this video, I'm going to be giving you my top 6 tips on passing the AKT exam. And this is the GP specialist exam. It's a written paper, multiple choice questions, but basically what it tests is all your medical knowledge that you need for general practice. So let's get straight into it. The first thing I want to touch on is what are your 3 learning resources? And you have 3. One is your day job. So you're seeing patients every day and you can learn a lot from your patients, and particularly if you get feedback based on what you do around their management. And we'll talk in more detail about that shortly. The second one is studying. So this is reading through guidelines, resources, textbooks, other things that you sit down and study to absorb information. And the third one is self-testing. So that's using multiple choice question banks or testing your knowledge with other resources like flashcards or short answer questions. And we'll get onto that as well. So these are your 3 resources. Now, you need to use all 3 of them. If you just use your day job and you don't do any studying, you're not going to cover everything that could possibly come up in the AKT exam, because your day job is a bit limited. If you're on a placement, for example, just in Paediatrics, you're not going to learn any adult medicine. You're not going to learn any palliative care, Obstetrics and Gynaecology, all these other topics that you need to learn. So just relying on your day job on its own is not enough to pass the exam. You need to study and you need to do testing. If you just study, you don't take advantage of the testing effect. Because you're not using your day job effectively, you won't be able to apply that theoretical knowledge, and the exam is testing your ability to apply that knowledge. That's why it's called the applied knowledge test. And if you just do testing, and this is something that I really try and hammer home with GP trainees that I mentor or teach, is don't just do testing. Don't just rely on, say, GP self-test or past medicine. You need to also combine the testing with studying and the day job, because the testing that you do only gives you very narrow snippets of information, and you need to be able to apply that knowledge in context. For example, if you're doing past medicine and you just test yourself on the cardiology stuff without studying around it or applying that knowledge in your day job, if you just test yourself, and you're on past medicine and there's a question about atrial fibrillation, which scoring system do you use to decide whether to anticoagulate a patient? The answer you'll learn and you'll drill that particular answer into your brain, but in the exam, it won't be phrased in exactly the same way with exactly the same answer. It will be a slight variation. And if you've only done practice questions, you won't be able to adapt to that variation. So you need a combination of all 3. My tip number 1 is to complete the feedback loop, which sounds a bit sort of wishy-washy. What does this really mean? Well, let's have a look at what happens if you don't complete the feedback loop. So you take an action. Let's say you see a patient, you think they might have a urinary tract infection, and you do something based on that action. So you prescribe them, say, a completely inappropriate medication. You prescribe them methotrexate to treat their urinary tract infection. And then you don't get any feedback on that. So you don't check with your supervisor, you don't read any guidelines, you don't follow the patient's results up to see what happens. You just give them that medication, send them away. And because you have no feedback, you don't know whether you did the right thing, and a habit forms, which is very dangerous. This could be that you've prescribed methotrexate for a suspected urinary infection and is completely inappropriate, but because you have no feedback, you go away and think, oh, I must have done the right thing there. And then the habit forms and you start doing that for every patient with a suspected UTI. So this is a bad thing. You need to gain feedback. So let's have a look at a good feedback loop. You take an action. So you see a patient, you suspect they have a UTI, you send off a urine sample, and you give them some antibiotics. Now you gain feedback by speaking to your supervisor and saying, do you think that was the right thing to do? Should I have prescribed something different? Should I have managed them differently? Was that the right diagnosis? Or you check the guidelines and say, okay, I suspected a UTI. Which antibiotics should I have given them based on the local guidelines? Or you follow up that urine sample in a couple of days' time to see whether it is actually a urinary infection. And this way you gain feedback, and then you can reflect on that and say, oh, I prescribed trimethoprim, but the local guidelines is for nitrofurantoin. Then you learn from that feedback. So you take that learning and apply it to the next patient. And this way, because you have a feedback loop, you're continually getting better. A good analogy for this is I like to play basketball. And when you're practicing shooting the basketball, what you look for is, did the ball go through the basket? Was my shot a bit too short? Was it a bit too far? Was it a bit to the left? Was it a bit to the right? And then each time you shoot, you adjust based on what you learned from the feedback of the last shot. So with feedback, you continually slightly improve your ability to shoot and get better and better over time. Without feedback, it's a bit like having a wall in front of you with the basket behind. So you're shooting the basket over the wall, not knowing whether it actually went into the net or not. This is an example of trying to practice something without gaining feedback. You'll never get better at shooting the basketball without knowing whether it's actually going through the hoop, whether it's a bit to the left, whether it's a bit to the right, whether it's a bit short. You're just stabbing in the dark and you'll end up not improving. Tip number 2 is to isolate time and space to practice. What does this mean? Well, time refers to a specific block of time where you're going to study. So if you imagine your typical day, you have to look, okay, what's this block of time that I'm going to block out where I'm just going to study and do nothing else? If you don't block out a space of time, what happens is that all the other things in life, all the other responsibilities that you have in your life will start to creep in and you'll never actually get any studying done. Or you may, procrastinate, put it off, and then you might get 10 minutes of studying done and then think, oh, I've done a bit of studying, I'll go and cook dinner, or I'll clean up a bit, or I'll do this other thing. And you'll never actually get solid blocks of work done. But if you isolate that time and designate it to studying, you will. And then space refers to a particular location where you go to study. If you decide you're going to study on your sofa and it's the same place where you relax, maybe you eat food there, you hang out with your friends there, you watch TV there, you do all sorts of other activities in that space, it's not really going to be very useful as a productive place to study. So in order to isolate space, I would designate a particular area where you go to study. For me, I like to study or work in coffee shops or in an office or in the library at the university, or even in the in the hospital doctor's mess if there's a good place to find some quiet space for that. But having a specific place where you study is really helpful. So I would suggest that what we're aiming for when we're studying for the AKT is uninterrupted, focused learning for a very specific block of time. If you're being interrupted constantly, your brain becomes distracted and you don't really have that deep, focused learning that results in the information sticking in your brain. And if you can do 1 to 2 hours of studying per day, say 5 days a week, I think that's very ambitious. To be honest, I don't think most people will get 1 to 2 hours of studying done per day. If you achieve this, I think you'll do very well in the exam. Most people won't do that much. So the question is, what did I do for my exam? Well, I'm a morning person. So I like to get up early and then use the morning for my most productive activities. And then by the time the evening rolls around, I'm pretty useless. I need to just go to bed pretty early. But other people might be a night owl, so they find that once they get to sort of 7, 8 o'clock at night, that's when their brain is working the best. So it's useful for you to figure out, are you a morning person? Do you work best in the middle of the day? Do you work best at nighttime, mid-afternoon? When is the best time for you? And block that time for the most difficult and challenging and highest value activity that you need to do. In this case, revising for the AKT exam. So for me, I wake up at 5 a.m. and then I kind of get up, shower, have coffee, all the kind of typical things you do in the morning. I used to leave home at 5:40 and then I'd arrive at a coffee shop called Tim Hortons, which was in Manchester, where I was doing my GP training. And then I'd start revision at 6 a.m. with a Tim Hortons coffee in hand. And then I'd have 2 hours of uninterrupted, focused work before I left for work at 8 a.m. Tip number 3 is to maximize efficiency. What do I mean by this? Well, let's say you work 1.5 hours per day and you do that 5 days a week. To be honest, that's really ambitious. I don't think most people will do this. And you do that for 3 months preparing for your AKT exam. So this is quite an intense preparation schedule. I don't think most people will achieve this amount of work. But let's, for this example, say that they do. That's 90 hours of revision for the AKT. It's not a lot of time. If you think in medical school, say you were putting in 30 hours a week, this is only 3 weeks of work. But this is 3 months of work when you're working full-time as a GP, or even part-time, if you're really aggressive and ambitious with how much work you're doing. So what do we do with that 90 hours? One thing you can do is try and make your own set of notes. So you can trawl through all the guidelines through the BNF. You can try and summarize everything into your nice block of notes. To be honest, I think that is not a good use of time because it doesn't embed that information in your brain. What you have in your notes doesn't help you in your exam unless you know it. So if you spend all your time creating a perfect set of notes and you don't have enough time to actually learn the notes, when the exam comes around, you'll have forgotten everything. And we'll talk in more detail about that later. And then there'll be some time wasted where you're kind of looking at different resources. You're looking at reviews for study products. You're just scrolling on Instagram, just wasting time generally. And then you only spend a small amount of time learning and getting that information to stick in your brain. This is not ideal. What we really want to do is spend the majority of our time getting information to stick in our brain. All that useful information going into the brain so that when the exam rolls around, we've got it there ready to access. So I would suggest starting with a ready-made set of notes. If you try to create your notes from scratch, you'll spend hours and hours creating notes and not get enough time to actually learn them. So start with a ready-made set of notes. There's loads of resources you can use for this. One of them is to steal the notes of somebody who's recently done the exam and done really well. Or you could start with something like the Zero to Finals books. If you go to zerotofinals.com/books, I've given these books to loads of GP trainees who've gone on to pass their exams, and they contain everything you typically need to know as a GP. And they're based on the UK guidelines and all the kind of resources they'll expect you to know about for your AKT. So a really useful place to start and really easy and simple to get started learning from. Yeah, so let's move on to an interesting study comparing note-taking with active reading. And I'll talk in more detail about active reading in a second. So this is Carpike and Blunt from 2011. They took this idea of concept mapping, which is essentially making notes in the most effective way of making notes, which is to take information, say you access the guidelines, and then creating a content map, which is like a detailed representation of that information in your notes, reorganized into a way that you find useful to learn. And this is actually very active note-taking, as opposed to simply just copying it out line by line, word by word, without really thinking about it. So concept mapping is making notes, but using your brain to try and understand it while you're making the notes. And they compared that to something called retrieval practice, which I call active reading. So retrieval practice, or what I call active reading, is to read through a topic. So say you go into the Zero to Finals book and you find the topic on atrial fibrillation or asthma, and you read through that topic, and then you close the book and you try and come up with everything you can remember. So you try and recall actively all the things that you can remember about that topic, and then you go back into there and check how accurately you've remembered them. So you essentially read, try and recall it from memory, then check your answers. And so they took two groups of students. They had one student do this concept mapping or note-taking technique, and the other group do the retrieval practice. And then after 1 week, they sat an exam to look at how much they remembered from this scientific information that they'd had to read. And what they did was they asked them first, which one do you think will help you retain the information for longer? And the students thought that concept mapping, or taking notes in a detailed way, would be more effective for them retaining the information than retrieval practice. Interestingly, on the actual test, the students scored much better who had done the retrieval practice compared with the concept mapping. So this active reading is more effective than detailed note-taking. Both groups of students spent just the same amount of time studying. So this kind of proves that if you're going to be making notes, even if you do it in the most detailed way, that doesn't help you retain the information as much as actively reading that and trying to recall it from memory afterwards. So zerotofinals.com has got basically almost everything you need to know for your AKT, completely free on the website. There's no adverts on there, nothing. You can go straight on the website and start reading about these topics, including all the guidelines that you would need to know. There's a few things it doesn't cover, like statistics, the kind of organizational things that you'd need to know about the GP contracts and so on. There's a lot of those will be coming in sort of the next 6 months to a year onto the website. There's also a podcast, medical revision podcast, so you could start studying these topics on the go. And I know loads of GP trainees have used the podcast to study for their exams. And then if you start with, say, the Zero to Finals books, and you're going through asthma and you find that there's something missing, for example, you see a patient with asthma, some kind of complex situation arises, and you realize there's a detail missing from the book, you can simply take a pen, like a colorful red pen or something, and write it directly into the book. There's plenty of space in there for you to add your own notes if there's anything missing. That will save you so much time in gathering everything together. So tip number 4 is to combine studying and testing. There's several benefits to studying. What I mean by studying is this active reading technique, actually reading through content and trying to test yourself as you go by retrieving it just after you've read it and then seeing how much you've retrieved. The thing about studying is it helps you to build an overall understanding. If you just test yourself, you don't build that overall understanding. You only drill the very specific facts that you've tested yourself on. Studying also gives you the context to where information fits in. If you're doing random fact testing on on a question bank, your brain doesn't really know where to store that information. There's no context around it. So if you imagine your memory is like a giant library and you've got all these different books, and the librarian is presented with a random book on dinosaurs. This is what it's like being tested on very specific facts using a question bank. The librarian then has to decide where to put this dinosaur book. If you're studying as well as testing, the librarian knows that it goes in the dinosaur book, in non-fiction, and so on. So they can go to that specific place and put it in place. Then when you're in your exam and there's a question on dinosaurs, and you ask the librarian to go and retrieve that information, they can go very specifically to the dinosaur section, take out that book, and it's there ready to go. If you're doing question banks without studying, and you have no context, they get given this random dinosaur book and they just throw it into a giant pile. Then when you're in your exam and there's a question about dinosaurs and you ask the librarian to go and get that book, they don't know where to go. They have to go and sift through this massive pile of books, and chances are they won't find it. So studying really helps you encode information in your memory really effectively within the context of the situation so you can retrieve it. Studying also fills in the gaps in your knowledge. Often there's things that you don't even know that you don't know. And if you're studying through like a useful resource, it'll start to fill in gaps that you didn't even realize existed in your memory. And then testing, you don't want to study on its own because testing has some really powerful effects as well. For one, it gives you feedback. So if you study cardiology and then you do some practice questions on cardiology, what happens is you get a score for the practice questions that you just sat, and that score tells you how effectively you studied cardiology. If you study it and then you don't test yourself, you could be studying in a really inefficient way. But if you study and then you test yourself, you get feedback to say, yeah, that study session was pretty good. You should keep studying like that. Testing on its own also improves your memory, and I'll talk about that in more detail shortly. And the testing helps you practice for the exam scenario. You don't want the first time you start doing multiple choice questions to be when you sit down in your exam. You want to have practiced that format lots and lots and got really good at it, so that when you're in your exam, it's a really easy format for you to do. So this is a psychological study by Rodinger and Carpike in 2006. So they took different groups of students. They had one group do studying twice. So let's say they studied a passage on asthma. Then after they studied the passage on asthma, they studied it again. And then they had the other group, they study the passage on asthma, but then do some questions on asthma, so some testing. So the first group studied it twice, the second group studied it once and then tested themselves on it once. And they spent the same amount of time going through those passages. After 5 minutes, the study group scored the best, but then when they looked at how well they retain that information after 2 days and after 1 week, studying and testing gave a much more powerful retention of information effect, meaning that studying and testing helps you retain information much longer than studying it, even if you study it twice and for the same amount of time. So I got this concept called the testing sandwich, and this involves doing short answer questions, then studying some content, and then doing multiple choice questions. So let's say you apply this to endocrinology and thyroid function. You do some short answer questions on thyroid function to start with. That gives you a baseline knowledge of how well you retain that information, and it also helps you prepare and prime your brain to absorb new information about that topic. So it's like a warm-up, and it gives you an idea of how well you already know the topic. Then you do this active reading, or retrieval practice while you study through the content on thyroid function. And then you do multiple choice questions, which help you understand how well you've studied, practice for the exam, and also help you to retain that information using the testing effect. So this is my recommendation for how you study a topic. Tip number 5 is spaced repetition. So this is a concept called the forgetting curve. And when you listen to me talking at the minute, or you attend a lecture, or you read through a topic, you read through a set of guidelines, that information, you'll have almost, say, 80% of that information retained in the first 5 minutes, but very quickly forget everything. So within a few days, you're down to 30-20% of what you read or listened to or studied. And then by the time your exam rolls around in a couple of weeks' time, 3 months' time, you've basically forgotten everything. This is a big problem. So what's the solution to this? The only solution is repetition. You need to go through, say you're really weak on hormone replacement therapy for women going through the menopause, and you study that information, you will forget it in a couple of weeks. You need to study it again in, say, a few days' time, a week's time, a month's time, and those repetitions help to retain that information. The brain is very good at getting rid of memories and information that it doesn't need. And the only way to tell it you really need this information is to do multiple repetitions. The spacing effect shows that if you space out those repetitions, that helps you retain the information longer than clustering repetitions together. So don't do 3 repetitions 3 days in a row. Instead, do one set now, 1 repetition in a week, 1 repetition in a month, and that spacing will mean that the repetitions and the retention of information is more powerful. Tip number 6 is to track your learning. And there's multiple ways you can track your learning. Importantly, I would list out all the topics that you need to cover before the exam, and then make a note of when you studied them and what scores you get on the practice questions that you're doing. And by making a note of when you study them and your scores, this really helps to organize your time so that you're doing spaced repetitions of that information and you're studying the things that you're not so good at or you don't score as well on more often than the things that you're really good at. So for example, if you study through endocrinology and you score 90% on your questions, on your practice questions, you probably don't need to spend as much time studying endocrinology. On the flip side, if you study renal medicine and you score 10%, you probably need to do more repetitions of renal medicine before your exam to make sure you address that weakness. So tracking is really helpful for that. I'm going to jump into the Zero to Finals members site and show you the tracking resource that we have there. Here we are in the Zero to Finals members site, and you can see there's short answer questions, multiple choice questions, extended matching questions, flashcards, a fact trainer, which is really a type of Anki kind of tool where you can rapidly test your knowledge on facts. But what we're talking about is this tracking tool. So let's say create a new exam, and you've got the AKT exam coming up in a couple of months' time. And there's all these topics you can add straight away. Or you can add custom topics, say HRT, and you save that. And that then gets listed as an exam in the study tracker tool. Tells you your exam's in 9 weeks and 6 days. And then you've got all these study sessions. So let's say you do a study session on cardiology, and that study session is today. And after studying cardiology, you've got medium confidence, and you say week on AF management, just as a note. You don't have to put a note in. Save that. Then you've got this cardiology session recorded today. And you've also got your exam results up here. So you can see that on short answer questions, you score 33% and so on. Then let's say you do another topic. You do another study session on gastroenterology, but you're very confident on gastroenterology. That gets recorded here. And then let's say you do a topic on urology and you've got very low confidence on urology. You save that. You can see these are ordered so that the things you're least confident on float up to the top. You can also see your exam results for each of these. And say you cover urology again, but this time you've got high confidence because you've done it twice and you feel like you're really getting to grips with the urology topics. Urology then floats down to the bottom and you can see got high confidence because you've studied it all these times. So this helps you, and then you can see a progress bar. Ideally, this all wants to be green, showing high confidence for all the topics. So you can then see you need to cover all of these topics. And then when you've covered all these topics and you decide, what should I study next? You can look at what's at the top, meaning the lowest confidence. And it's also ordered by how long ago you studied the topic. So this study tracking tool shows your progress, it shows your strengths and weaknesses, and it shows you what you need to cover next as the highest priority. And this helps you make sure that you prepare everything and you're ready for the exam on the exam day. And a final note for you on data interpretation and statistics. I've been training GP trainees and helping them to get through their AKT exam for quite a while. And the thing that everybody worries about loads is data interpretation and statistics. And I want to make 2 points on this. The first one is that they're not trying to test your knowledge of obscure names and graphs and formulas. What they're trying to do is get you to interpret new information in an accurate way. So what they're going to do is present you with some data. This could be in a graph, in a chart, in a table. And you may never have seen this type of graph before. And what they'll do is ask you a question which challenges you to interpret that information. So for example, they could show you a graph that shows you some information about mortality rate with a new medication. And they're going to say, which dose of the medication gives the highest mortality rate, for example. And then you go to the graph and you look at the dose and then you look at the mortality rate and you line the two up and then you give that result in the exam. So most of the stuff on data interpretation and statistics, you can interpret from the information they give you. You don't need any prior knowledge. You just need to say to yourself, okay, I think I can work this out. Let me take a moment and just look at this graph, try and understand it, and come to the answer. People think that they're going to go into the data interpretation question, and it's going to be like, what's the name of this really obscure graph that no one's ever seen before? And all the names are funny sounding, and you're not really going to be able to work it out. Actually, you can pretty much work out everything from what they give you. The other point I would make is that this is some results from statistics on AKT number 51. And what you'll see is clinical knowledge was actually the weakest area. So people scored 73% on clinical knowledge. And on evidence-based practice, which is statistics and data interpretation, they scored 78%, which is actually the highest thing they scored on. So what you really need to do is focus as much as you can on the clinical knowledge, because that's most of the questions and the thing that people are weakest at. And evidence-based practice or statistics, what I would suggest is that you practice interpreting graphs and interpreting data and just get an idea and get a feel for interpreting new information. and that will help you in your exam, as opposed to just rote learning formulas and rote learning names of exams. So I hope that was helpful. They're my top 6 tips with a few extra things thrown in for passing the AKT exam. Good luck to you, and I hope you do really well, and I'll see you in the next video.